StablePlate RX was developed for the treatment of acute, uncontrolled hemorrhage in bleeding patients. In this video, we'll identify most common diseases that lead to bleeding due to platelet loss or dysfunction, discuss the reasons for platelet transfusion, uses in trauma, severe tissue injury, and traumatic brain injury. Platelet loss or dysfunction can be caused by a variety of conditions or diseases. In addition to primary immune-mediated thrombocytopenia, infectious thrombocytopenia caused by ehrlichiosis, Lyme's disease, Rocky Mountain spotted fever, anaplasmosis, tick-borne fever, tularemia, and listeria. Causes of drug-induced thrombocytopenia include nonsteroidal anti-inflammatory drugs, cephalosporins, and some types of chemotherapy. Thrombocytopenia can also be secondary, immune-mediated, from bacterial pathogens, heat stroke, and spider or snake bites. Platelet transfusion is needed for life-threatening bleeding and increased vascular permeability, accompanied by extravasation of fluids and proteins. However, platelets should only be transfused when there is a reason, not just in response to a low platelet count as measured by lab tests. In trauma cases, trials have shown that patients who receive early transfusions of plasma and platelets have a much higher survival rate and reduce the chance for hemorrhagic shock. StablePlate RX can be used for severe tissue injury, bone fracture, or burns to help speed up healing by circulating platelets in the damaged area. It can also control hemorrhage after a stroke or traumatic brain injury, as platelets pass the blood-brain barrier and accumulate in the area of vascular leak or hemorrhage. StablePlate RX is designed to stop the bleeding in your patient, reducing the need for ancillary blood products, surgery, or other critical care interventions. StablePlate RX Canine was designed as a convenient, shelf-stable product that's ready for use in patients within minutes. They are each screened in accordance with ACVIM Consensus Statement for Blood Donor Screening, published in 2015, and vaccinated in accordance with the AVMA core vaccine recommendations. To learn more about StablePlate RX Canine and its benefits, please visit our website.